Good afternoon. How are you all? This is I'd like to introduce my new knee. It's a gift to the private sector. It's made of titanium, and hopefully it'll last at least through this presentation. So, and frankly, it's within a theme, but it's from doing too much running exercise over 30 years, I think, and not choosing other less joint unfriendly types of activities. So enough of my knee. Let's talk about environmental change and physical activity change and a couple of projects we've done here in San Diego. And I think very consistent with the previous theme of what can we do to make healthy behaviors easier and maybe unhealthy behaviors a little tougher to engage in. So there we go. Okay, these are two studies I'm going to report from a work at the Institute for Behavioral and Community Health at San Diego State University, about 15 miles east of here. And this is not just my work, but that of many of my colleagues, especially mention Suchi Ayala, Greg Talavera, and Elva Arredondo, who they and others have put together quite a portfolio of research over the past 30 years, 3 decades now, many of us, and so I'm going to be reporting on their work as well as mine, just to show you some of the work we're doing in physical activity and environmental change. Like any of you who have had a behavioral health or behavioral social science class in the last 20 years, you've probably seen the socio-ecological model. The various versions are pretty much the same. The important issue there is that change at one level needs to be supported by changes at other levels, at higher levels. If we want personal, individual change, we need to make sure that the environment supports that change, as the last panel was discussing. If we want community change, we need to make sure that organizations and individuals are supporting that change. So these are interactive and iterative interrelationships between individual, group, family, if you will, friendship networks, organizational and community levels. And it's seldom can we afford to do things at all of these levels, but it's always at least important to keep in mind that we have to be aware of the impact that other levels have on any one level. We often talk about individual change. These changes at the individual level are seldom sustainable unless we do something with these outer rings. Okay, so we'll talk about a little bit more about physical activity. One study that we've done with kids and another with adult women. And building on, as this slide shows, the premise that human beings are naturally active people, and we do a lot of things to make physical activity more difficult, I think, and to make sedentary behavior just really easy to engage in. So some of the work we've done has looked at not changing the individual so much and not dealing with all this black box up here and the gears that will change this attitude or that thought or that emotion, but trying to change the environment, build it and they will come kind of idea. And two studies we've done, one with kids, Aventuras para Niños in schools, and another with adult Latinas, Caminando con Fe, walking in faith or walking with faith. And then Fe en Acción is Elva Arredondo's follow-up study to that. Okay, so a little bit about Aventuras para Niños. We were funded to change obesity by changing the environment. So that was a big task. I was never really sure, even when I applied for the funds, that was possible. But I certainly was intrigued that NIH was going to invest in this, and I certainly wanted to be a part of that group that got a chance to do something. So we did get the grant, in the last decade that has informed much of the work we've done since the mid-2005 or so. So this was conducted on the border, just south of here, about 15 miles south of here, in what we call the South Bay area of San Diego. For those of you, most of you would know that, where that is, I guess. We randomly assigned schools to environmental change, both of their school environment and the neighborhood around the school, and then to just individual family change. Home intervention, where we have promotores, community health workers, go make home visits to work with families on environmental change for healthier nutrition and better physical activity in the home. And you can see this child is just riveted by some of the intervention information we're sharing here, and just can't wait to get started in our project. But one of the main things, so we're talking about physical activity here, so this is where we're making sedentary behavior far too easy. And we talk about calories being inexpensive now, and that is true, and bad calories are really inexpensive, high caloric, high fat foods. And almost anybody can afford these now. That has changed so much in just a generation or two. But sedentary behavior has gotten to be really inexpensive as well. And so what happens a lot is we see in neighborhoods with very modest or challenging economic circumstances, we see more and more kids have their own AV systems in their rooms and even televisions in their own rooms. And so this is a problem that our promotores had to take on and try to do something about. And it wasn't easy, because the parents felt that that was a wonderful gift they could give their child, that he or she could have a TV right in their room and control it themselves and within limits watch what they wanted to watch. So this is one of the environmental efforts that became a real challenge for us. And we frankly weren't that successful, because that involved parents buying into a different way of thinking about their relationship with their kids. We did school interventions as well, trying to change both the nutritional and the physical activity environment of the schools. The Spark PE program, changing how active the PE classes were when they did occur. We found a lot of schools did not follow the state prescriptions on these, but we did use Jim Salas and Tom McKenzie's Spark program to promote more active PE classes. We tried Take 10. I don't know if any of you have ever heard of this, but in any case, teachers using physical activity to train in math and language. And this was, I'll mention it in a minute, but this was challenging selling to teachers on this. But here you see a teacher, an elementary school teacher, walking the kids through a math lesson by using physical activity to count and divide and stuff. Peaceful playgrounds. Basically, we looked at schools in the South Bay region and found that they were mostly just plain asphalt. There were one or two pieces of equipment on the school grounds. And what Peaceful Playgrounds is simply designs that can be painted on the school grounds. And we thought, well, this seems like a good idea. You can spread the kids out. They can invent games. If we had prescribed games, the kids did not need them. They jumped right out at recess and engaged in their own activities, invented games. So this was just a wonderful experience until the kids got a little bored, so we did have to invent some games. But then, one Friday we left feeling really good about Peaceful Playgrounds, and then Saturday this happened, and Monday our Peaceful Playgrounds had gone. So this is not the actual picture. You can see those trees are back east somewhere, but But this is what happened. So we did not, the school principal was not in touch with the superintendent on how to maintain these things, nor we with the school principal. So there was a disconnect in our multi-level approach. And then community change in the neighborhoods surrounding our schools. And what we found was that parents would not take their kids to the park. There were graffiti all over the place, the restrooms were locked, the water fountains did not work, and in the grass, which wasn't mowed very frequently, there would be syringes, used condoms, all sorts of nasty stuff that they did not want their kids exposed to. Quite naturally, nobody would. And so what these community health workers did was took pictures of the parks in San Ysidro and Chula Vista, and San Ysidro went to the San Diego City Council and shamed them into fixing these parks up through a slideshow. It was really quite wonderful. So there's a kind of a before and during. The after pictures I don't have, but these parks are really much different places now. So there's a check for $300,000 or $400,000 that the city of San Diego gave us just to fix this place. Wonderful success story. This didn't occur till after the study was over, so there was nothing for us to document, but nevertheless felt quite good about it. Okay, so some things that didn't work. Walking school buses, that was one of the things we were going to do in Aventuras, and it did not work. The parents did not want to be involved in being responsible for taking other kids to school. So even that was a great idea, very logical, but it didn't work. A lack of communication regarding peaceful playgrounds. We did not, again, we didn't find out from the principal that they were going to repave the playground until it was far too late. And then Take 10, it was one of the most unpopular programs ever that I tried to implement. Because we weren't listening to the teachers. That male teacher you saw, he was the only teacher who was really excited about it. We didn't understand that control in a classroom is one of the teacher's biggest needs, and that and we weren't working with that agenda. So that was an important lesson we learned. Okay, so let me switch to Caminando con Fe just briefly. This is in Catholic churches. This is a pilot project that the National Cancer Institute funded, and then Elva Arredondo now is finishing up a full-scale project. Various Catholic churches around, I think in this case mostly the South Bay of San Diego again. So direct behavior change was involved. Working with the women and bringing them into fitness groups and having them lay-led, where they could work out in a comfortable surrounding. It was familiar to them, and it wasn't outdoors. We found out these women did not like to exercise outdoors. They did not want people watching them while they were wearing exercise clothes, things of that nature. So we did find that that was fairly effective by providing child care and an indoor facility at the church in their neighborhood. They did become active. Then we had various activities in the parks, but many of these were just ceremonies. But we also targeted the physical environment by, again, looking at the immediate church grounds and the neighborhood around them, and then the parks nearby. So you can see that on the church grounds and nearby there was a problem with pedestrian signage, there was trash, graffiti, things of that nature. The city wasn't necessarily, or the garbage companies weren't picking up the trash when they should have. So some of these things were taken on by our churches and quite successfully so, to promote a more aesthetic and exercise supportive environment. We had back fences. People were running from the cops, had a place to hide in the church grounds, and the back fences were repaired, and the sewage lines that were supposed to be draining far down the street were repaired, and sidewalks were targeted for repair as well, with some success. Again, City Council got involved. We went back to them and said, you know, we need these repairs done. We need the parks cleaned up. We want women to have a better chance to exercise in comfort of their neighborhoods with their children and families. So we were very successful in making changes in the environment, I think, at the church level. And again, some of these churches, they wanted to support more physical activity. They did not know that their environment needed to be more supportive of that. And that worked out fairly well. We got significant physical activity change among the women who were participating. And again, this is parlayed into a current effort that Elva's analyzing the data on right now. So, environmental success stories. Again, new basketball court, some outdoor facilities at the churches, increased safety and security in the neighborhood around the churches, so people could at least walk down the street and feel safe and take their kids with them, which is a very important priority for many of our participants. We didn't really get changes in the perceived environment. People didn't say, oh, gee, the place is safer. So we didn't get that attitude change. But I think what some of our research is showing is that a perception of an environment and the objective security and safety of the environment are two different things. That people can live in fairly dangerous environments, if you look at pedestrian accidents and even crime records, and feel safe somehow. And conversely, people in relatively safe environments, that's at least according to police blotter and hospital records, all that stuff, may somehow see that these environments are dangerous. So we don't really see that link occurring to the extent that would seem logical. Linking physical activity with the perceived environment. So this is something we want to work on more in the future and are working on, to make sure that people are in sync with either making changes that need to be made or with being realistic that indeed they can go for a walk in relative safety. The rolling this out with lay leaders, with priests, with the diocese, was a very slow process. It involved a lot of listening to them and taking their concerns into account, and putting all of our efforts in sync with, of course, the mission of the church, which is spiritual and not physical. Okay, so I think the things we need to learn is that these changes, these environmental changes, are important in and of themselves. In Aventuras, we saw wonderful changes in parks, in school cafeterias, in restaurants, and even in home environments that then translate into obesity changes. And in the churches, we spent a lot of time on the perception of environment and those sorts of things. That wasn't necessarily related to increased physical activity. But I think what's important is we got to back up and say, you know, ugly fruits and vegetables are good. That's a good thing. Doesn't matter if you lose weight or if you have other health outcomes that occur with it. It does matter, of course, at some extent, but accept that consumption of fresh fruits and vegetables is good. We accept that kids exercising is good, that drinking water is good. And I think that the main lesson we've learned in these environmental change studies is making sure we have the right marker to evaluate whether an environmental change actually works. If a park is cleaner and all the graffiti is gone and the water fountains work and the lights are on and the place is safe, that's good. Doesn't really matter if people lost a lot of weight who live across the street from that park. And that's it. Thank you very much.